السلام عليكم ورحمة الله وبركاته. والسلام عليكم تاgeerayaasha inta sama jecel inta youtube-ka subscribe ku ah inta nagu cusub nagu soo dhawaada cashirkii aan bilaabay oo ahaa Institute Integrative Nutrition programkii ahaa oo aan idin sheegay oo rotationkiisa aan soo qaadanay oo maanta aan rabo maajalkii koowaad inaan bilaabo ama chapterkii koowaad. aad baa uga faa'iideysanaysaa luuqadda ingiriisku ku baxaa wixii commenti ah ama su-aal ah commentiga igu soo qoraysiin anaa idinka caawinayo. waa programka aan ka graduate oo aan shahaadadiisa haysto oo i caawiyey oo kaa caawin doono also mental, emotional, spiritual, physical intaba kaa caawin doono. waa program muhiim ah caawinayo dadka haddaad si wanaagsan oo toos ugu dhaqantidna kaa caawinayo afartaas shay nutritionka inaad baratid, si hab caafimaad inaad u noolaatid, exercisekaada daily inaad samaysid, 10 years younger inaad noqotid, waxaas dhan uu kaa caawinaya. marka kusoo dhawaada maajalkii koowaad ayaan rabaa maanta inaan isla qaadano. hab online una ku baxaa, luuqadda ingiriiskuna ku baxaya. welcome.
Welcome to Module 1 and the beginning of your health coach training program. I'm Nora and I'm so excited to help guide you through what will be a life-changing experience. Before you get started, I want to run through a few basics about the course and some of the content you'll see across the modules. Every module begins with an introduction to what you'll learn and a set of essential questions that connect to the module's theme. We created these to help you ground into the learning before you start the module, but they're also helpful if you ever get lost in the details and feel like you need to reconnect with the themes. Each module includes content that relates to personal health and coaching, brought to life by our IIN team and visiting faculty members. You'll round out each module with assignments and discussions that will help you get the most out of your HCTP experience. Your work in the course will build to the creation of a personal transformation or business plan, so I encourage you to consider your intentions for enrolling. It may shift as you move through the modules, and that's fine. But think about what you want to achieve during the course. It may be specific or entirely vague at this point. No matter what it is, just know that you have the power to transform your life and help others do the same. And this is where you begin. One of the goals of this course is to help you reframe your thinking about health and help you understand what's right for you may not be what works for everyone. So, in Module 1, you'll begin exploring what health truly is. You'll look at your own fundamental needs and connect with what health means for you personally, not your partner, not your neighbor, but you. You'll be introduced to IIN's vision and approach to wellness. As our name suggests, we take an integrative approach to wellness, so you'll see conventional wisdom along with complementary and alternative perspectives. And as you explore how these methods align with your own goals, you'll come to understand just how expansive health really is. Health is everything, and everything is health. In this module, you'll see why it's important to prevent illness rather than just treating it. And you'll look at the differences between healthcare and sick care with Dr. Andrew Weil. This module introduces you to two of IIN's core concepts, bioindividuality and multidimensional health. As you learn about each, you'll start to see how health encompasses many levels and is unique to each person. It requires some experimentation and curiosity, and sometimes you have to step outside the norm to find your own way to optimal health. Dr. Will Cole will share how bioindividuality and multidimensional health show up in his functional medicine practice every day. Pilar Gerasimo will show how to apply what you're learning so you can live your healthiest life in an unhealthy world. Here at IIN, we believe that coaching isn't just a profession, it's our way of life. Our integrative coaching method, which you'll learn about in this module, reflects exactly that. Developed over the last 3 decades and steeped in years of experience educating students, it will set the course for who you become and how you live. This method embodies our core philosophies. Everything you'll learn about health coaching stems from this method, and you'll return to it regularly throughout the program. It's flexible, effective, and transformative, and it provides a foundation for your development, both personally and professionally. More than anything else, this first module sets you on the path toward healing and thriving, redefining your life, and living in alignment with your purpose. As you build awareness around your fundamental aspects of health, you'll begin to discover how you can improve your health, change your life, and change the world.
maasha allah majalkii koowaad faahfaahintiisii ayaa meeshaas ku dhammaatay. waa still majalkii koowaad, cashirkii koowaad oo qaybta koowaad oo majalka koowaada la dhahaa. aad ayuu idin anfici doonaa. I hope inuu idin caawin doono because asoo Soomaaliyeysan in the future ayaa insha allah aan la imaanayaa. laakiin hadda kow waa inaan asoo ingiriisa isla qaadano. af ingiriiskan wuxuu idinka caawinayaa, inta badan Soomaali way ku hadashaa luqadaas. wuxuu idinka caawinayaa dadka labada luqad yaqaan, dadka aan aqoonin in the future insha allah Soomaali idinku soo duubaya haduu ilaahay idmo. wuxuu idinka caawinaa programkan inuu xataa in the future haddaa rabtaan inaad qaadataan hordhac, like idinkoo wax idin bilaaban yihiin inaad majalki qaadataan idinkoo wax idin bilaaban yihiin. laakiin idinkoo waxba ka ogeyn xoogaa uu idinku adkaanayaa. marka that's why aan idinka caawinayaa online. qofkii raba inuu iskuul ahaan u bartana waan ka caawin karaa, wuu kusoo biiri karaa. wuxuu maaragtay helaya discount. galaasyaasha waa free ma aha, lacaga ku qaadanaysaa. hadaa wadamadan qurbaha joogtid xitaa financial aid ma bixiyaan, only adiga inaad jeebkaada ka baxsatid waay. marka qofkii raba in laga caawiyo hadduu rabo inuu jeebka ka baxsado wuxuu helaa discount. online ana lagu qaadanaa 100%.
Hello, it's Dana, and I'm here to talk about IAN's unique approach to health. When you hear the word health, what comes to mind? How do you go about achieving being healthy? Everyone has their own ideas about what it means to be healthy. Some people may want to look at numbers on a chart. Others will focus on the presence or lack of disease. Then there are those who will think of it as a state of mind. Still, others will focus on what they eat to determine whether or not they're healthy. And while none of these ideas are wrong, focusing on just one aspect of health can ultimately limit your understanding of it and your ability to achieve it. And that's what makes IAN's approach so special. We understand that there is no one way to optimal health. We understand that health is bio-individual. There's no one-size-fits-all solution. There is no right or wrong. We all have unique needs that will change over the course of our lifetime. So, at IAN, we view health as an opportunity to nourish and heal the mind, body, and soul in all the ways you need over time. An opportunity to live in alignment with your purpose and beliefs. An opportunity to transform every area of your life and those of your clients. An opportunity to experience vitality so you can give your best gifts to others. How do we do that? We start by taking an integrative approach to health and well-being. The HTTP curriculum embraces all truths, integrating different perspectives, a mix of science and spirit, intellect and intuition, experience and innovation, to create a program unlike any other that you may encounter. We incorporate functional medicine approaches. We look at the body's interconnected systems. We focus on uncovering the root causes of disease, not just the symptoms. We investigate factors that trigger and perpetuate health issues. We explore how knowing your own health history will help you heal. We also consider the importance of personalized nutrition and the interplay between food, lifestyle, and social and environmental factors. We do this through teaching about a blend of modern health modalities, such as nutrition-related lab testing, in addition to ancient complementary and alternative health philosophies, including Ayurveda and traditional Chinese medicine. In the Health Coach Training Program, you'll learn not only tangible evidence and action-based strategies to support health, but also to tap into the innate intelligence of your body and take a holistic, multidimensional approach that considers body, mind, and spirit. You'll learn to trust your intuition to guide you on your journey toward healing so you can live in alignment with your full potential. No matter where your health journey is starting or where it takes you, we encourage you to honor your individuality and the unique path you need to follow. You already have great potential inside you. As the largest and leading health coach school, we'll help you awaken that potential. As you move through the program, you'll gain deeper insights into your own wellness, become more perceptive of the nutrition and lifestyle behaviors that feel best for your body, and maybe even redefine what you believe it means to be healthy. You'll learn to discern, personalize, and experiment with course theories and concepts as you embrace your own truth wherever you find it. You'll reclaim your power to transform yourself, learn to help others do the same, creating a ripple effect that can also transform the world. We are so excited that you're here and to be on this journey with you. I look forward to seeing you again soon.
ما شاء الله عجل saddexaad aan ugu daraya oo maajilka koowaad and then videoga maanta intaasuu ku eg yahay oo ahaa jabtaradii ama maajiladii Institute Integrative Nutrition oo ku magac gaaban IIN. Programkan wax badan ayuu naga caawin doonaa, aad buuna faa'iido u leeyahay, faa'iidadiisana lama soo koobi karo. waa wax walbo isku jiro, mental, emotional, spiritual, physical, wax walbo.
Hi, good afternoon. It's a pleasure to see you all. So I thought I would begin by giving you a little my take on the healthcare crisis that we have in this country. I want to talk to you generally about the philosophy of integrative medicine, integrative healthcare, some about my ideas about nutrition, and finish by talking a bit about breath, which I think is the single most important thing that you can learn to do correctly. So first of all, we do not have a healthcare system in this country. We have a disease management system that's functioning very imperfectly and getting worse by the minute. And sadly, the diseases that we're trying to manage are mostly diseases of lifestyle that could be prevented if people early enough made better decisions about how to eat, how to handle stress, how to rest, how to get physical activity, and all the other things we know contribute to health and longevity. We spend more on our health than any other people in the world by a long shot. If I were to show you a bar graph of per capita health expenditures of the NATO nations, our bar is off the chart. And at the same time, we have worse health outcomes than any other developed country. You know, this is something you should all know. The World Health Organization rates us 38th on a par with Serbia. And that's any way you look at it. It's infant mortality, longevity, rates of chronic disease. Something is very wrong with that picture. You know, we're spending more and more, and we have less and less to show for it. Also, it seems to me unconscionable that the richest nation on earth can't guarantee access to basic health care for all of its citizens. I mean, that is just not right. So how did we get into this mess? What can we do about it? Why has healthcare become so expensive? The first reason, as I said, is that, you know, we are trying to manage these diseases which are rooted in lifestyle choices, and the methods of conventional medicine just don't work for them. You know, we have epidemics of hypertension, obesity, type 2 diabetes. All of these are not well managed by the methods of conventional medicine, but they are all preventable if people, as I said, made better choices. And secondly, the methods that we try to use are dependent on expensive technology, and I include pharmaceutical drugs in that category. Integrative medicine is certainly not opposed to the use of medication, but when we do use medication, it's always in the context of an integrative treatment plan that begins with lifestyle change. And I would say a keystone of lifestyle change is dietary change. And if medication has to be used, the principle that I follow is you start with the lowest dose of the least potent agent, and you can always work up from there as needed. But often, with lifestyle change alone and the use of natural remedies and mind-body methods and all the things that are not really taught in conventional medical training, it is possible to avoid the use of medication or to use it minimally. I think the overuse of medication in our population is one of the great sins of conventional medicine. And there's a number of problems with that, and I just want to mention the ones that I think are most important. The first is the amount of direct harm caused by the medications that we use. Also the expense. I mean, this is a major contributor to the expense of healthcare. But I doubt that you're aware of the extent of serious harm caused by pharmaceutical drugs. The estimates that I've seen are that just in the hospitalized population in this country, there are between 200,000 and 400,000 deaths a year directly due to medication. And this is not mistakes. This is the right dose of the right drug for the right person and the right indication, and hundreds of thousands of people a year die. That's not acceptable. And that's just deaths. That's not to mention, non-lethal adverse outcomes. The other problem, which I think is much less obvious, but one that you should all be aware of, and one that you should be able to explain to patients, is that the drugs that we have come to use are counteractive in nature. They oppose physiological processes. And one way you can get a sense of that is that if you look at the names of categories of drugs, almost all of them begin with the prefix anti. We use antidepressants, antispasmodics, anti-epileptics, anti-this, anti-that. This is counteractive medicine, that these are strong agents that oppose physiological processes. Now, if you're in a situation where the body is badly out of balance, it's very nice to have access to drugs that rapidly push it back in the right direction. But once you get the body back into balance, it's important to back off the use of those methods, because if you persist in giving that kind of an agent, you run into a problem that I think often gets you into worse trouble than you had to begin with, and that is the homeostatic reaction. Homeostasis is the body's tendency to maintain equilibrium. If you push against an organism with an outside force, it pushes back. If you do something to it that raises its internal temperature, it has mechanisms to lower its internal temperature. One example that I can give you that I think most people can relate to is that if your nose is clogged up and you spray into it some kind of drug that causes blood vessels to constrict, magically within minutes you can breathe again. And depending on which drug you used, in 2 or 4 hours when it wears off, there's a rebound dilation of blood vessels, and you can't breathe again. And if at that point you add another dose of the drug, it's very easy to slide into a pattern of dependence where you can't stop using that in order to breathe. So that's an example you can use with clients to help them understand this problem of what I call the homeostatic trap. A much more serious version of that is what happens in our treatment of gastroesophageal reflux. A very common problem. We use these powerful acid blocking drugs, the proton pump inhibitors, the purple pill, that oppose the secretion of acid in the stomach. What happens if you give a drug that blocks the production of acid in the stomach? What's the body going to do? It's going to try to make more acid. And then if you put a person on one of those and try to reduce the dose or stop it, there will be an outpouring of acid worse than you had to begin with. which convinces people they have to stay on them. These medications were never intended for long-term use. They were originally only by prescription use. Now they're over the counter. People are put on them at the first sign of complaining about heartburn. I can't tell you how many patients I've seen who've been put on these drugs without any dietary history being taken. People come in and complain of heartburn and they're automatically given a prescription for one of these agents. There are all sorts of problems with these drugs. They increase rates of certain kind of cancer. They have been associated long-term use with increased risks of dementia. A whole bunch of stuff. But the worst problem is their addictiveness, that once you start on them, it is very, very difficult to get off of them. And you will deal with clients who are dependent on these and want to get off them, and that is not an easy thing to do. You have to really learn all sorts of tricks, starting with making sure that people aren't using, that they're not, you want to look at things like intake of coffee, decaf, things irritating in the diet, alcohol, smoking, stress, which relates to stomach acid, all of these things. There's some natural remedies like chamomile and deglycerinated licorice that help protect the stomach from irritation by acid. You have to put all these things in place and then try slowly to wean down on the dose. There was a study reported in the New England Journal a few years ago in which they took a group of young men who had no stomach symptoms, put them on one of these drugs, proton pump inhibitors, and I think it was after 6 weeks they stopped them and all of them got reflux disease. So the drug caused the problem that it's meant to stop. Look at SSRI antidepressant drugs. These have been, first of all, increasingly found to be ineffective, that you can't really distinguish them from placebos in most studies. But what happens if you give a drug that increases serotonin at neural junctions in the brain? What's the body going to do over time? It's going to make less serotonin, and that's going to drop serotonin receptors, so that when you try to stop the drug, you will have a worse problem you had to begin with, and this is now called tardive dysphoria, which is a fancy way of saying lingering bad mood due to the drug. So it may be that for very severe depression, that using these things for limited periods of time, I would say certainly no more than a year and maybe less than that, maybe that's justified. But it is not so easy to get people off them, once they've been on them for any length of time, because depression comes back with a vengeance. So you want to be very aware of this problem of relying on suppressive or counteractive medication to deal with chronic health problems. It's okay to use these things short term to get the body back into a position of balance. But once you do that, you want to back off that and find other ways of maintaining the improvement. For instance, with depression, there's a long list of things that you can do, starting with getting people to be regularly physically active, to increase intake of omega-3 fatty acids, make sure their vitamin D levels are good, a whole range of psychological approaches like cognitive behavioral therapy, spiritual approaches, including things like keeping a gratitude journal. I could go on and on and on. But there's a whole array of possible interventions other than relying on the medication. The problem is that in conventional medicine, medication is the one technique that's taught, and most of these other things are not included in the curriculum. And this is where I think integrative medicine has so much to contribute, because it's got a much bigger view of what's available out there. So the challenge is, how can we turn this whole enterprise of disease management around in the direction of health promotion and disease prevention? That's not an easy question. Why can't we do a better job at preventing these lifestyle diseases? I'm afraid that has a very simple answer. Prevention doesn't pay. And until we can figure out how to make prevention pay, we're not going to get anywhere. And the other very hard fact you should be aware of is that as dysfunctional as our current healthcare system is, and it's very dysfunctional, it is generating rivers of money. And that money is flowing into very few pockets. It's the pockets of the big pharmaceutical companies, the manufacturers of medical devices, the insurers, and the for-profit healthcare companies. And those vested interests don't want anything to change, and they have total control of our elected representatives. So there is no possibility of change coming from the government. The only way that I can see change happening is if there is a grassroots social political movement, which I hope you will all be part of, in which people get angry. In which people get angry enough about the situation and we begin electing different kinds of representatives who have not made those deals with those vested interests. I don't see that happening yet. It is up to you, people who understand the situation, to convince other people about how it is so that we can get that kind of a grassroots social political movement going. I have great confidence that those kinds of movements can change everything. But at the moment, it's bad, and health professionals are as much victims of this system as patients are. When I talk to our graduating classes at our Center for Integrative Medicine at the University of Arizona, I tell them, doctors should be marching in the streets at the moment. I don't know why they're not. They are totally victimized by the system. They've lost their autonomy. They're forced to do treatments that they don't believe in necessarily, because that's what the people who control the institution say has to be done, because this is what makes the money, and on and on and on. Anyway, it's a mess out there, and I hope we'll see some change. We're now spending, I think, something like 18% of our gross domestic product on health care. It's predicted to go up to 20%. That's completely unsustainable. It's going to wreck us as a society, so something has to change. And I really hope you are all part of that change that's going to happen. Let me say that, first of all, let me just list for you what I think are the key components of an integrative approach to medicine and healthcare. First is to emphasize the organism's intrinsic capacity for healing. That's hardly a new idea. Hippocrates in the 5th century BC said to revere the healing power of nature. That principle has been completely lost in modern times. You get a cut on the surface of your body, watch it heal over the next few days. That, what you see on the surface of the body, goes on throughout the body. Every cell, every organ has the potential for healing, for regeneration, for repair, for adaptation to loss. And it seems to me that good medicine, good health care begins with that idea. When I sit with a patient, always at the back of my head, I'm thinking, why is healing not happening here? What can I do from outside to facilitate it? Can I look for something that's blocking it and remove it? Can I supply missing energy? What can I do? And often that the problem is not in the physical realm, it's in the non-physical realm. And that's the next, I think, big point about integrative healthcare, is that we look at whole persons, not just physical bodies. We're also mental, emotional beings, community members, spiritual entities, and you have to look at those other dimensions of human life in order to understand health and illness. And the narrow focus of conventional medicine on the physical body greatly limits its effectiveness. It is often in the non-physical realm that you will find the causes of problems that are manifesting in the physical body. And one of the areas in which I became aware of this was in looking at Chinese medical philosophy. There's a principle there that I like. The Chinese say that all visible disease is preceded by invisible disease. And by invisible disease, they mean a disturbance in the energy mechanics and circulation of the body. And they say that if invisible disease is not identified and corrected, eventually it will manifest in the physical body, at which point it is much harder to reverse or modify. So this is part of whole person medicine. Don't restrict your view just to the physical body. Next, I think integrative medicine really places a lot of emphasis on lifestyle, as you do in your training here. And I think lifestyle medicine, the emphasis on that puts us in a very strong position to offer real preventive care. Because I think, to me, the meat of prevention is about how to live. It's not about sanitation and vaccination, all that's important, but it's really about lifestyle choices and how they impact, long-term health and risks of disease. And you want to get up to speed about that, of really knowing, and also not only get up to speed about that, but knowing how to motivate patients to make changes in their interest. And the fact is, it is much easier to take a medication than it is to make a lifestyle change. Medication often works quickly and there's no requirement for effort. Lifestyle changes take time to produce their effects, sometimes weeks or months, and they take effort. So you have to be able to convince people why it's in their interest to do that. And explaining that argument about the homeostatic trap is one way to do that, that the advantages of correcting conditions through lifestyle change have lasting effects that increase with time, whereas reliance on counteractive medication fail you over time and in fact get you into trouble. So you have to be able to explain that to people. There's also two other things I'd recommend to you. The first is you have to be able to exemplify health and healthy living to patients. That's one of the best ways to convince people to make necessary changes. Without saying anything, you have to be a model of health. And secondly, I urge you to learn the technique called motivational interviewing, which is a very sensible, learnable method of engaging in dialogue with a client to identify what are the mental obstacles to making change and then helping them to find ways around them. So exemplify health in your own living, learn the technique of motivational interviewing, be able to explain to people why lifestyle change is a better long-term strategy than relying on counteractive medication. These are very important techniques. And then, the other aspect of integrative medicine is that you have to be willing to learn about and make use of the whole array of techniques available out there for modifying health and physical conditions. And, this often gets us in integrative medicine in controversies with the evidence-based, medicine people who say that we're advocating things that are unscientific or anti-scientific. And I'll just tell you what my personal guideline is for this, is that if I'm looking at methods which have not been thoroughly studied and where the evidence is, there's not a lot of evidence for them, that you want to first pay attention to whether a technique can cause harm. And the greater the potential of a treatment or a therapy or a supplement to cause harm, the stricter the standards of evidence it should be held to for efficacy. That's a very simple principle. And if we adhere to that in conventional medicine, we'd save ourselves a lot of trouble. Just as one example, I think that looking back on the past 50 years, the era of recommending or really forcing hormone replacement therapy on women at menopause will be looked back on as one of the great debacles of 20th century medicine. And women were often made to feel foolish if they resisted taking hormone replacement at menopause. And there was an assumption, we knew that there was an assumption of evidence for the benefits of this in terms of obviously alleviating menopausal symptoms, but also improving bone health, reducing coronary artery disease, and so forth. And that those benefits exceeded the risk. But in fact, we did not have evidence for those benefits. And the evidence for the harm in terms of increased cancer risk was very clear, and people ignored that. So I think that's a good general principle that, I'll just repeat that, the greater the potential of a treatment, intervention, anything to cause harm, the stricter the standards of evidence it should be held to for efficacy. Just a very simple way of operating. I am firmly convinced that integrative healthcare is the way of the future. And I think that, I hope that our current healthcare system doesn't have to collapse totally, but it might have to. It might have to. It's in such bad shape. And maybe only out of a total collapse can we create some other kinds of ways of doing it. I have, ideas of what I'd like to see. For one thing, well, first of all, let me say, I think, it's very possible that conventional medicine, allopathic medicine, will become a specialty. It'll be a specialty for dealing with crises, with terminal illness, with very severe illness, and it will be practiced mainly in large urban health centers, which are the only ones that are going to be able to afford all the equipment and technology. I think a lot of smaller and community hospitals may not be there anymore. And it's interesting to think about what might take their place. One thing that I have thought of is to see a new kind of institution come into being that I call a health and healing center. So just imagine this with me, that this would be an institution where you could go to have your lifestyle tuned up. This would not be for terminal care or critical care, but it would be, you could go there if you were well, to have your lifestyle analyzed and see how you could tweak it for the better, or you could go there for learning how to manage common health conditions, allergies, pain, autoimmunity, all sorts of things that are not well managed by conventional medicine. And that the care in these institutions would be team-based, and I very much believe that team-based care is the future. So there would be integratively trained physicians, nurses, pharmacists, as well as nutritionists, health coaches, people, exercise physiologists, a whole range of mind-body therapists and so forth. And when you went in, you would have somebody analyze your situation and point you in the right direction and recommend how you could best use this facility while you stayed there. And in addition, when you stayed in one of these places for whether it's like a weekend or a week, you would learn about some skills like how to cook, how to prepare food, maybe how to grow some of your own food. Just imagine, first of all, how nice this would be. Also that the practitioners working here, how good it would be for them to be in a place where they could attend to their own well-being. And I would see that stays in these institutions would be paid for in whole or in part by insurance. And I think that's a very reasonable goal. There's even actually there's a model for that from some of the countries in the former Soviet bloc. I know this was true in East Germany and communist Poland, that workers in factories were required by the state to go twice a year to a spa. And this was fully paid for by the government because it was found that workers who did that were more productive. So that's just an interesting model to look at, something that might work. But think about that. Of what kind of an institution that you might like to work in and practice in, and how great it would be to work with a team of people with diverse talents. I think this is all possibly on the horizon today. I am a great fan of health coaches. My daughter, who went through this program here, is a health coach. She's mostly doing online nutritional consults. But I've been telling her that I think an even bigger future and potential out there is to be what I call a health navigator. And I recommend this to you as well. My experience in the past couple of years is that more and more people are utterly confused when they have to deal with the current healthcare system. People have a diagnosis, they have a problem, and they don't know which way to turn. Should they go to conventional medicine? Should they go to a Chinese practitioner? Should they try to take care of things themselves? How great if you could go to someone who had, a broad knowledge base and could just help you find your path in this confusing, maze of healthcare choices that are out there. So whether you want to call that a health coach or a health navigator, I think this is a real need out there at the moment that I see, and I think you are all training to be qualified to do that. And one thing to do is to find colleagues to ally yourself with, who have different knowledge areas than you do and different skills than you do, who can help you get up to speed about that. I just see a great market for this and a great need for it today. I have to tell you that almost everyone I know who has interacted with the healthcare system in the past few years has really come away not better for the interaction. You know, they've been hurt by it physically, financially, emotionally. It is not a pretty picture out there, and there's a real need for people to counsel and give advice and help people find their way in this. It's interesting to look at how far integrative medicine, how the advances it's made in the U.S. It is beginning to happen all over the world, but the U.S. is so much farther ahead. And the reason for that is that we are much farther over the cliff in terms of the collapse of the healthcare system. You know, looking back on my own career, you know, I've been writing and saying the same things about health, medicine, medical education for over 40 years. And in the beginning of that time, nobody paid much attention to me. And then I got a larger and larger following in the general public, but none of my medical colleagues paid any attention to me. Now, I remember there was a period in the 1970s when there was in this country a holistic health movement. And in Tucson, there was a Southern Arizona Holistic Medical Association. The members were nurses, psychologists, social workers. There was not one physician other than me who was in it. And that didn't change until the early 1990s. And that was when the economics of healthcare began to go south. So the lesson that I've drawn is that institutions, ideological argument moves nothing. It's only when the pocketbooks of institutions get squeezed that they begin to open to new ideas. And the pocketbooks of our healthcare institutions are being really squeezed right now. So if you look around the world, as the conventional healthcare system begins to collapse, that is when openness to integrative medicine and integrative healthcare begin to develop. So I think the future is ours. You know, time is totally on our side. None of the problems that I've talked to you about are going to get better. The forces that have taken down our healthcare system are building everywhere. We have aging populations. As people get older, they get sicker. You know, the oldest people are the ones who are the greatest drains on the healthcare system. Everywhere we're seeing these epidemics of lifestyle-related diseases develop. You know, it's a childhood obesity, hypertension, type 2 diabetes. When I was in medical school, this was called adult onset diabetes. Then we had to call it teenage onset diabetes. The youngest that I've seen this diagnosed in the Native American population just west of Tucson is 2 years old, often preceded by morbid obesity that begins at 1 year old. I mean, this is unimaginable that this could have happened, but here it is. And type 2 diabetes is a perfect condition for you to help people with. You know, it is a mismatch between genes and environment. You know, most of us have inherited genes that make us very good at storing up calories when they're available. You know, we evolved in periods of when food was available sporadically. It was feast and famine, and often famine. And these conditions selected for genes that made individuals very efficient at storing up caloric energy when it was available. That did not anticipate that we were living in a time when caloric energy was super abundant all the time. And it used to be said that these genes were present only in certain populations. It looks like it's in all populations. You know, that used to be said that we didn't see these as frequently in the Chinese. But when Chinese immigrants moved to New York City, Chinese kids developed early obesity and type 2 diabetes at the same rates as non-Chinese. So I think these genes are universal. You know, they're everywhere. And as I say, it's a mismatch between genes and environment. But the great news is that condition can be so easily reversed by changing lifestyle. If people can reduce caloric intake, lose weight, increase physical activity, learn how to reduce consumption of high glycemic load foods, understand that. I mean, that alone, in many, many cases, will put type 2 diabetes into total remission. And how wonderful that is, without the use of any medication. So that's an ideal condition for you to be working with. And to just, again, tell you about the problem we have of the control of the system by vested interests, I'll just give you this example. There was some years ago, the New York Times ran a week-long series on the diabetes epidemic in New York City, which is horrific. And one of the articles did an economic analysis of the situation and pointed out that for every nutritional consult, for every consult about physical activity that a person did in a healthcare center, the centers on average lost $75. For every amputation of a diabetic limb, they made $6,000. So, it's a no-brainer. That's the way the system is set up. This is what I mean. It says prevention doesn't pay, and intervention does, and that has to change. But here, we have the epidemic of type 2 diabetes in our culture is one of the greatest problems that we're facing today. And you are totally equipped to deal with that, by helping people understand that mismatch between genes and lifestyle and how to make changes that can cause that disease to go into total remission. One of the Native American groups that live where I live, and just west of Tucson, are called the Oodom. And when the U.S. border was redrawn in the 1800s in the Gadsden Purchase, the new border went right through their territory. So half of them wound up in the United States and half of them wound up in Mexico. The Mexican Oodom, and these people were sedentary agricultural people who lived on a traditional diet of corn, beans, and squash. They were physically active. They were not on keto diets or paleo diets. They were eating starches, but they were slow digesting starches like beans and winter squashes. They were, as I said, physically active. The Mexican Oodom today look pretty much as they did when that border went through their territory. The American Oodom have ballooned up into 300 and 400 pound individuals with 90% rates of type 2 diabetes and hypertension. Their diet is ring dings and big gulps of sodas and the worst offerings of our modern industrial food. And the results are obvious, but also there is a small study in which some of these enormous diabetic, obese, hypertensive Indians were put back on their traditional diets, and very quickly the weight melted off, the hypertension normalized, and the diabetes went into remission. I mean, that's very encouraging, with the possibility that even in this extreme form, that kind of disease could be manipulated that way. So I think your work is cut out for you, and really I think you are the people who have an enormous amount to offer in the way of lifestyle counseling and navigating the system. In the minutes I have left, I want to talk to you about breathing, which is one of my favorite subjects. I was asked before I came out today, like, what is your most important tip that you could give people about health? And I said, it's learn how to breathe. That may sound very simple because, we all breathe, but I don't think very few of us have been given instruction on how to breathe. There's finally some attention being paid to this. There was a recent book that I recommend you called Breath by James Nestor, Nestor, that's really good and has a lot of practical information in it. What I learned about breathing, I did not learn in medical school. I learned it from two sources. One was studying yoga, because there's a whole division of yoga called pranayama that deals with breath and energy circulation. And I also learned it from working with old osteopathic physicians, DOs, who placed a great deal of emphasis on correct breathing. One of the basic principles of healthy breathing is to breathe through your nose, not through your mouth. You know, many people breathe through their mouth for various reasons, and we have evolved in the direction of mouth breathing in recent years for a lot of reasons. One is the nature that we chew much less than our ancestors did. We've come to eat a lot of soft food, and that's actually changed the shape of our skull and jaws that favor mouth breathing. Anyway, you want to breathe through your nose. You also want to learn to extend exhalation and make that equal to inhalation. Most people who are not trained in breathing, exhalation is much shorter than inhalation. It's very important to get as much air out as you get in. So the qualities of breath that you want to develop, and this is, by the way, I teach all people that I meet, that I teach, that I do health consultations with, I give them instruction about breathing. I think it's that important. But the qualities of breath you want to develop are to make your breathing deep, quiet, slow, and regular. So whenever you think about it, you know, if you're standing in a line somewhere, if you're driving, try to make your breathing deeper, slower, quieter, and more regular. If you look at people who are anxious, angry, afraid, breathing always changes in the direction of being rapid, noisy, shallow, and irregular. You can't have those things, those two things don't go together. You can't be in an agitated state of mind and breathe deep, slow, quiet, and regular, and vice versa. So that gives you potentially great control over your mental, emotional state. In order to make breathing deeper, you want to work at blowing more air out, because exhalation is the phase of breathing you have greater voluntary control over. If you get more air out, you automatically get more air in. So a very simple technique to practice is, at the end of a breath, try to blow more air out. And I'll show you what I mean. Just take a breath in through your nose and let it out through your mouth. And now more, until you really feel that squeeze there. So just practice that whenever you think about it. At the end of a breath, try to squeeze more air out, and you will automatically take more air in. And the more air you exchange in your lungs, the healthier you are. This oxygenates the blood, get rid of carbon dioxide. It's a good thing. The physiological changes are remarkable after 6 to 8 weeks. Lowered blood pressure, improved digestion, improved circulation. I mean, all sorts of things. I mean, this is a wonderful thing. Learn it yourselves. Do it with other people. It's a great thing to do with kids. Do it with clients. I do it with all patients that I teach. I do it with all groups that I talk to. And I like to remind you, as I will do now, that the literal meaning of the word conspiracy is to breathe together. So I hope we are engaged in a conspiracy for better health. Thank you very much.
inshallah maajilka koowaad oo 3 video aan ka daawanay intaasuu noogu egyahay. aad baa u mahadsantihiin inta channelkayga ku xiran, inta nagu cusub nagu soo dhawaada. waxaa noo bixi doono 30 chapter, 40 chapter oo ku saabsan caafimaadka, nutrition, oo iskugu jira mental, emotional, spiritual, physical, afartaba iskugu jiro. aad baa u mahadsantihiin. ka faa'iidaysta, dadka kale la sheer gareeya. وبالله التوفيق.